Welcome back to Phenomenal Health. I'm Grayson Foster. If you're just joining us, my guests today are Dr. Scott Danoff and his wife and partner, Dr. Laura Danoff. They are two of the top dentists practicing in the Great Neck and Little Neck areas. And Dr. Laura, welcome to the show.
Thank you.
Very happy to have you here.
It's a pleasure to be here.
All right, you have incredible credentials and training as well as your husband. So can you just take a moment to share with us a bit of your background?
Sure. I graduated from the University of Pennsylvania, magna cum laude. I went immediately to the University of Pennsylvania School of Dental Medicine, where I achieved a DMD degree. I'm very proud to tell you that I just celebrated my 25th anniversary from dental school.
Wow.
And soon to celebrate my 25th wedding anniversary as well. So it's a very special year.
Amazing, amazing.
I then went to New York University College of Dentistry. I came home to New York, and I got a postgraduate degree in orthodontics. About 10 years after that, I became a diplomate of the American Board of Orthodontics, and this I'm extremely proud of. I follow in the footsteps of my dad, who's also an orthodontist and also a diplomate.
Really?
And this is the highest honor an orthodontist can achieve. And less than half of orthodontists practicing today in the United States and Canada have this degree. So something I'm extremely proud of.
Wow. So that's why you have such beautiful teeth, because your dad was an orthodontist.
My dad did my orthodontics.
That's great. Now, may I also add that you have 5 children?
That's right.
So I don't know how you did it all, but here you are. Congratulations.
Thank you. My husband is a big support, and you have to be organized.
Absolutely. Wow, incredible. All right, let's talk about Invisalign, because this technology is really amazing. So explain exactly what Invisalign is and how does it work?
Invisalign is the clear, invisible way to straighten one's teeth without using metal braces or ceramic braces. It uses a series of aligners. I brought some here to show you.
Great.
That gradually move the teeth into position.
Right.
And as you see, they're removable, and they custom fit to the patient's mouth.
Right.
Not exactly easy to remove on.
There you go.
But
that looks great. Now, how long does a patient have to wear these?
Every case is different.
Right.
I'm going to put these back on.
Okay.
The shortest treatment plan is typically 5 months, and it can go on from a year, year and a half. But they've got to change. Cases have an average of a year.
But they've got to change them out every 2 weeks or so, right? Different liners.
Every 2 weeks, the patient changes the aligners. There's some people consider them the contact lenses of braces.
Yeah.
Because every 2 weeks they change them, and that way they're always clear and they always look terrific.
You don't have to worry that people know that you're wearing braces.
Exactly.
Yeah.
That's the biggest advantage of Invisalign. You can actually straighten your teeth without anyone knowing it.
Yeah.
I often see patients in the supermarket, and I'll go over to them and say, "You're not wearing Invisalign," and they say, "Yes, I am," and I'm always amazed how clear it truly is.
Now, I'm sure with the invention of this technology, the ages of your patients have gone up, because I'm sure more adults are doing this now, right? Because they missed out on orthodontics as a kid, and now they might be in their 30s, 40s, 50s, whatever, and they want straight teeth. Isn't that what you're kind of experiencing in your practice?
I've never seen more adult patients come into the office as I do today. It used to be maybe 25% of patients that were adults seeked orthodontic treatment, and today it's at least 30 to 40% that come into my office regularly who want their teeth corrected without wearing metal braces or ceramic braces. And it's the answer to so many patients who are older. I have patients who are in their 70s who sit in the chair and they actually cry because they're so happy that they can finally have those spaces closed, or their teeth that were rotated their whole life, that they smiled for pictures or the wedding pictures with their lips together, and they were so embarrassed about showing their teeth. So it's finally an answer that has come true.
Now, you're an Invisalign Premier Provider. What exactly does that mean?
It means that I'm very proud of that. I became a Premier Provider 2 years ago. It means that I do an exceptional number of Invisalign cases, and I also take extra continuing education classes that deal with Invisalign.
Okay. I bet your adult patients are more diligent about wearing them than probably the younger people are, right? When it comes to orthodontics?
Adult patients are the best patients because they want to get them on and they want to finish as soon as possible. So they do whatever it takes to to achieve this. And one of the added advantages of having Invisalign and being an adult patient is that you can bleach your teeth simultaneously as your teeth are being straightened, because you use the trays as bleaching trays.
Now, how does a person decide if they should use Invisalign or if they should just do veneers to straighten and make their smile beautiful or make their smile over?
Sometimes the individual tooth structure is what gives us the answer to that question.
Okay.
Very often a patient will go to my husband, Dr.
Yes.
Scott Danoff,
Yeah.
the prosthodontist, and he will be having a consultation for porcelain laminates on a given patient. We had one just recently, a supermodel. That was his answer. If she wants a quick fix and she wants her teeth to be straightened, she'd have to have a mouthful of porcelain laminates, and that's a definite answer for her solution because she has such crowded, crooked teeth.
Wow.
Then she came to my office, and I saw the individual teeth were quite pretty, the shape, the size, there was no chipping, the color was nice, and to me it was an obvious Invisalign case.
Yeah.
I saw the teeth could be proclined, could be expanded, could be widened. The patient's soft tissue structure would benefit because it would be on a wider circumference, and I thought this was an ideal patient for Invisalign.
Interesting.
And she could take them off when she's in the movies too.
Oh, neat. Now, you brought with you some nice befores and afters as well, so we're going to take a look at those right now. Dr. Laura, so this was an Invisalign case here where obviously you closed in the gaps, right?
This is a typical case. It took 9 months, and it was a upper and lower anterior spacing, and within 9 months the patient has a beautiful smile. All spaces are closed, and it's right in front of their mouth, so they're thrilled.
That's amazing.
This is just the opposite. This is a case of crowding, upper and lower anterior crowding, and this case took a little bit longer. It was about 15 months, but even this patient's soft tissue profile benefited tremendously. This is a deep bite. 4 pictures on the left, and the bite was opened up beautifully on the right side.
Right.
And you didn't even see the patient's lower teeth in the before shot.
Right.
So it's beautiful. This is a little bit hard to see. I apologize. This is an open bite case. The upper and lower teeth don't come together. There's minimal overbite, and at the end it was a perfect bite, and the patient's speech was affected beautifully because the patient had a tongue thrust to begin with and had more of a th sound. You know, instead of the S sound, it was more of a th, and so the patient was absolutely thrilled.
That's amazing.
This is just showing on the left side is the before picture, a V-shaped upper arch, and also crowding, and the rest of the mouth was perfect, the perfect bite, and that's what you saw when a patient smiled. So this is the right side, this is final photo, and it's just a beautiful U-shaped upper arch.
That's incredible what you can do with those clear plastic liners, right?
That are totally clear.
Yeah, amazing.
And no one has to know you're moving your teeth while you're doing it.
Yeah.
And it's also wonderful because the person can take out the aligners to brush their teeth and to floss their teeth, and so they can maintain perfect oral hygiene during the treatment.
Nice. We're going to take a look at some testimonials too that you brought with us right now, so let's take a look at those.
Hi, my name is Romina. I'm 33 years old, and this is my mother, Betty. We decided to do Invisalign together. We thought it would be nice and a bonding experience to get our teeth straightened together.
I am a patient of Dr. Laura Danoff. My children were patients before I was. They all have beautifully, perfectly straightened teeth, and I decided to finally do something for myself. When I signed on to do Invisalign, I was a total non-believer. And I took a picture of my teeth, not knowing how disgustingly crooked they really were, until a few months later I compared the original picture to my newly straightened mouth and was absolutely amazed. They are fantastic.
My friends and relatives tell me that I'm a lot more confident, I'm smiling a lot more. I've always liked to smile a lot, but I was very conscious about my smile. But now I like to smile, and I'm happy and very confident, and people tell me how pretty I look now.
In fact, they really are totally invisible. You don't even know that I'm wearing them right now.
Anyone considering doing Invisalign, don't hesitate. It's wonderful, it's painless, requires a little bit of your time and a little bit of effort, but no problem. Wearing it, I wore it daily, and nobody even knew what was in there, and the end result is well worth it. So go ahead and do Invisalign anytime it's being offered. It's a wonderful, wonderful thing that they have done for us.
And people, they give me so many compliments because of my smile, and they tell me that I look so good, and I have a new life now with my smile.
I love the patient there that was in her 70s and she did Invisalign. I think that's fantastic. Wow.
They're wonderful patients.
That's great. Okay, I do have to take a break now. But coming up after the break, Dr. Scott Danoff will discuss the latest in whitening treatments to keep your smile bright and white. Stay with us. Phenomenal Health returns in 1 minute.